So over here, this is the room where I have done my first 2 psychedelic therapy sessions. So right here is where the first legal use of psilocybin therapy happened in Canada.
Psilocybin, if you're wondering, is the active ingredient in magic mushrooms. And Thomas Hartle was the first Canadian to legally take them.
Psilocybe cubensis.
This is footage of Thomas about to go on that first psychedelic trip in 2020. Next to him is a doctor and one of Thomas's good friends.
It was a very pure emotional experience. Your entire being is that emotional feeling. So it isn't a matter of feeling it. You are that experience.
In any given year, hundreds of thousands of Canadians experience depression and anxiety. Could magic mushrooms be a revolution in their treatment? Or as Canadian law tells us right now, are they a dangerous substance we should avoid? To understand how Thomas, in his 50s, found himself hallucinating in his basement in Saskatoon, we need to go back a few years. Back to the day he was diagnosed with stage 4 cancer.
The anxiety for that was really consuming my every minute of every waking day. It felt like I was actively dying.
Thomas tried conventional ways to care for his end-of-life anxiety, such as therapy and meditation. He tried antidepressants too.
I know that antidepressants for me were able to take like the peaks off of anxiety, but they also were taking the peaks off of things like happiness and love.
When nothing worked, Thomas decided to try magic mushrooms. He applied to Health Canada, and a few months later, they gave him a special exemption to use psilocybin pills in the presence of a medical professional. Thomas says after his 4-hour psilocybin experience, the symptoms of his anxiety were basically gone.
It gave me the ability to approach the idea that someday I'm going to die and I'm not going to be there when my family needs me. It doesn't change the way that I feel about dying. It has changed the way that I think about the entire concept of death and dying. So, unlike a drug which changes how you're feeling while you are taking it, this is something that has changed my perspective on it.
But here's the thing. Health Canada only gave Thomas the right to use psilocybin for 1 year, and that's expired. He's asked for a renewal, but months later he's still waiting.
As it stands today, it would be illegal to do it here in this room for you.
For me right now, it would be completely illegal. So that which was previously the most safe and secure that I could possibly have is now something that would be illegal for me to do.
All the way over your feet?
Yes, please.
Okay, how's that feel?
Feels great.
For like $1 million?
$1 million.
There is another way to legally get psilocybin in Canada. You need to find a doctor who's willing to apply for you. That's what Dr. Michael Verbora does for some of his patients. For him, psychedelics are the future of medicine.
Remember, you will also have a guide with you at all times to ensure your safety and maximize the healing potential of this psychedelic experience. I got out of med school, residency about 7 or 8 years ago, and I knew at that moment I could not do what I was trained to do, which is to continue to prescribe pills every day for patients with chronic illnesses who weren't getting better. It was beating my head against the wall.
Dr. Verbora is a doctor at Field Trip Health, a private clinic in Toronto that specializes in psychedelics. He says because it's difficult to get permission to use psilocybin, he's only able to administer it to 1 or 2 patients a month. Mio Yokoi has stage 4 pancreatic cancer and end-of-life anxiety.
I thought to myself, if this is something that can help me to have a better quality of life for whatever time I have left, then I would like to try to experience that as much as possible. I believe that magic mushrooms can help me not suffer at the end of my life.
Mio wants to spread the message that psilocybin helped her. That's why she allowed us to film her treatment. Dr. Verbora never leaves a patient's side during their experience. And he tells me what he believes the psilocybin molecule is doing inside Mio's brain. He says it's like a reboot.
If you run software 24/7 on your iPhone or your computer, it starts to get slow and bogged down and it doesn't work good. But if you close all the software, you reset the computer, it tends to be faster, more efficient. And that's how these molecules work. They temporarily suspend the way we normally think, and they allow different parts of our brain to communicate with one another that typically don't communicate.
Dr. Verbora is convinced that psilocybin works. But at the Centre for Addiction and Mental Health in Toronto, psychiatrist Dr. Ishrat Hussain isn't so sure.
I don't think at this moment that we can say for certain that psilocybin is safe and effective for depression or any other mental health condition. There is encouraging evidence that it could be safe and effective, but nothing conclusive at present.
Dr. Hussain is the lead investigator in a new trial, the first of its kind commissioned by Health Canada to test whether psilocybin works.
So this is the CAMH psychedelic assisted psychotherapy treatment room. When we're administering the treatment, we want it to be quite ambient, soft lighting, as relaxing as possible for people.
Dr. Hussain says there's another question he hopes the trial will answer.
Starting now. That's whether psilocybin actually needs to induce a psychedelic trip to have therapeutic benefits. It's assumed psilocybin acts by sort of inducing this very powerful hallucinogenic experience, and that's why people seek benefit from that approach, but as yet nobody's tested that hypothesis.
That's important because if there's no psychedelic effect, then a patient wouldn't need as much support and the treatment wouldn't be as expensive. These days, Thomas Hartle meditates to try to cope with his anxiety. But he's not giving up on access to psilocybin. In fact, he's taking Health Canada to court as part of a charter challenge.
What I am asserting is that it is my right to have access to this treatment, is my right to live and be healthy here in Canada. Right now, the only way that I can do that is by having access to psilocybin-assisted therapy.
Health Canada won't comment on Hartle's situation because it's before the courts.
I don't know how I would manage to live with that. Without access to that kind of a therapy, having both cancer and being in this extreme state of anxiety, for me, it's not really living anymore.
Nick Purdon, CBC News, Saskatoon.
Well, let's connect now with Dr. Shimi Kang, a psychiatrist here in Vancouver. And you are the principal investigator for Canada's first study of its kind on magic mushrooms and their impacts on treatment-resistant depression. Tell us who could qualify now for this experimental treatment.
Currently, Ian, there's not a lot of options. One option is the special access, where a patient and doctor have to prove that they've tried every other treatment and get special approval. That is private pay, so it costs money out of your pocket. The second option is through research studies, clinical trials like the one you mentioned. There's one in Toronto at CAMH that we just heard about. Those don't cost money. However, there's no guarantee you'll get in, and there's quite tough exclusion criteria as well.
And so we saw people in the story taking it under very controlled, supervised circumstances. What would you say to anyone who's watching, who's considering self-medicating without supervision?
I'd say don't do it. These are very powerful plants. Yes, they're natural, but we know when used well, they can have profound health effects. We're seeing that. But when not used appropriately in the wrong dose at the wrong time without proper medical supervision, interactions for other health conditions or medications, there can be serious negative side effects. However, these are generally safe when used appropriately under appropriate trained, experienced individuals who know how to do these trips. And
so given that, where do you see this headed in Canada? Do you think it'll become a more mainstream treatment?
As a psychiatrist for 20 years, I certainly hope so. We do need more options in mental health as well. I feel that we are at the bridge of more studies. There will be more on their way. We have a lot more research, a lot more work to do in understanding the science. I'm very hopeful, but it's a tale of caution. We don't want what happened before when the psychedelics emerged and they got a very bad name and went illegal and underground, and a lot of serious consequences consequences occur to people's health. So we got to be careful. We have to be cautious. We have to be optimistic. But I think we're definitely headed in the right direction.
Dr. Kang, always nice to have you on the show. Thank you.
Thank you.